Last fall, employees at Mercy Hospital spent 5 weeks on strike, asking Catholic Health for better working conditions. Once the strike ended in early November, the two sides had agreed to higher wages, improved benefits, and a new aggressive approach to filling vacancies. But the unions involved in today's demonstrations are calling it an informational picket and say progress is being made toward a new agreement. 7 News reporter Sydney Yore joining us with more tonight.
Union members came together today to make sure their voices were heard. Many say they took to the picket line to bring attention to what they call less than desirable working conditions and staffing issues.
Since 1975, so it's been a while.
It's been almost 50 years since Cheryl Volker chose to go into the healthcare profession, but she says hospital conditions have decreased since she first began.
When I was younger, the patients weren't as sick. Now we are caring for patients on a regular floor without proper staff, and they're a lot sicker.
It's the understaffed and unacceptable working conditions that several union workers say are behind their decision to picket outside of Buffalo General Medical Center in Oshai Children's Hospital.
We came out to the picket to basically show Kaleida that we will not settle for a poor contract. We want a good contract with good patient care, be able to give the patients the care they deserve.
The CWA and 1199 are negotiating a new collective bargaining agreement and demanding the state invest in Kaleida's workforce.
We need about 436 new positions in order to provide safe patient care. Yet there's no revenue in the budget to support those positions.
Volker's son, James Volker, says he sees how much this has taken a toll on his mother.
I get to see her coming back more and more stressed and tired. Doesn't complain much, but at the same time, you know that she's having a greater workload day after day without the pay going up.
Picket organizers say out of 7,500 members in the Kaleida health system, 2,000 of them have quit or retired in the last 2 years. Volker says he understands why healthcare workers are choosing to leave their jobs behind.
Well, unfortunately, they're not going to likely see the same thing, the level of love and compassion that was there when people like my mom would start. They really had a heart, and they saw that heart being compensated for.
Volker says his mother plans on retiring soon, but she hopes the system improves for the future of healthcare workers.
For nurses coming up and graduating, coming into a hospital, our hope is that they have the right number of staff to be able to care for their patients.
Now, we reached out to Kaleida Health for a statement and are waiting to hear back. The CWA and 1199 and the Kaleida Health will return to the bargaining table tomorrow. Live in the studio, I'm Sydney Yore, 7 News.